Now I will show you the treatment on the patients. The patients as the consequences of the surgical treatment of the rupture of the Achilles tendon up to 10 years ago. In this case we have a fibrotic situation. It can happen in the consequences, in the course of the surgery in Achilles tendons. And with these two lengths I can work at first on muscle. So this unfocused lens allows me to treat the muscles. Why treat the muscles? Because so I can have a flow of the vascular, an increasing of the vascular flow in the nearby dilation of the tendon, and then I'll treat the fibrous tissue of the tendons with this little lens that is focused and superficial at the same time, and this with the objective to stimulate the fibroblasts and the other cells of the tendons, and to modify the structure of the tendon, working on the extracellular matrix. Okay, I start the treatment with the lens, unfocused lens, and I treated the muscles of the leg. I start with the modality of medium rise time of the shock waves and the intermediate amplitude of the shock waves. The level of the energy is up to 0.10 millijoule per millimeter square, and the diamagnetic effect is low. Then I will increase with the treatment as the treatment needs for a greater amount or not of blood in the tissue. As you know, the great aspect of the shock waves is the neoangiogenesis and the increase of the flow of the vasculature in the tissue. In this condition, treating the muscles is very important, because the muscles is in unit with the tendon, and they work together. So I can relax the muscle, stimulating the muscle with the shock wave. Now I changed only the magnetic flow, and you can appreciate a different sound of the lens. We have up 6 seconds between the first and the second and the other shots, because it's the time that is needing for the machine to recharge the electromagnetic coil that generate the shock waves. Now I proceed with the treatment that will be addressed to the tendon. This is the lens. In this case, I start with the lower level of energy flux density in stimulating mode and intermediate rise time of the shock wave. I start from the junction of tendon and muscle. And this is very important because it's as a stretching of the junction between muscle and tendon. Now I have a higher level of the energy flux density. And now I'm treating the fibrotic part of the tendon in correspondence of the surgery. In this case, the objective is to work on the fibrosis of the tendon, and with this lens, this little focusing lens, with the focus up to 1.5 centimeter, I can treat all the tendons, from all the Achilles tendons, by multiple directions, as you can see now. So the treatment is comfortable for the patients because this movement of the lens and this focusing ability don't give pain to the patient.